Bula Vinaka, and welcome once again to another segment of Speak Your Mind. I'm your host, Serafina Wedlock. Now, recently, being heard constantly on our radio and also TV news is the high reported cases of dengue fever. Now, the Central Division continues to report the highest number of dengue positive cases with, 283 recorded as of the 1st of November to the 30th of December, as reported by the Health Ministry. Now, of course, the Health Ministry spokesperson. Now, here to talk more about this is Dr. Shrish Acharya and also Mr. Vineshwan Rama, who is the Health Inspector for the Ministry of Health. Gentlemen, welcome to the show and thank you so much for being here.
Welcome, Sarah, and thank you for giving the opportunity to the Ministry of Health and to my colleague and myself to actually create some public awareness and talk to the public on this important disease called dengue.
Vinaka. Now, Dr. Ashwarya, now what is dengue and other different types? Are there different types of this virus?
Dengue is a sickness. It's like a flu.
Right.
It's not a flu, but it's like a flu. People tend to have fever, body aches and pains, and that's what dengue does. It's due to a virus. It's not a bacteria or a parasite, but it is a virus. And the scientists have found that there's 4 types of dengue virus.
So 4 types.
Yes, dengue 1, 2, 3, and 4. And a person can be hit by any of these types of virus. And this virus is not transmitted by handshaking or sharing a cup, but it's actually transmitted by the mosquitoes. So that's how the dengue spreads, and that's what dengue is.
All right. Now, how is this dengue virus spread?
So a person who has dengue, actually a mosquito bites that person, so
Right.
takes that blood and then bites another person. And then the virus gets transmitted from person A to person B by the mosquito, and the virus actually stays alive in the mosquito.
Oh, wow. So is this the regular mosquitoes that we in the night, or are they day-biting mosquitoes?
There is a specific mosquitoes that actually transmit dengue. They are
Okay.
called Aedes aegypti. My colleague Rama can elaborate more on that.
Yes, please do, Mr. Rama.
Okay, for Fiji we have 26 different species of mosquitoes.
26?
Yeah,
Okay.
and out of the 26, basically there are 6 species in Fiji which spreads dengue, and the major species that is spreading dengue virus is Aedes aegypti and Aedes albopictus. Basically, what we can see is these mosquitoes are more of domesticated mosquitoes.
Okay.
They breed basically close to the human or close to the houses, and they feed on human blood and then rest inside the house, and so that's why the transmission is quite high.
Oh, okay. Now, what are the symptoms associated with dengue?
Now, patients who actually develop dengue, it takes about 2-3 days from the time the mosquito bites you and then you actually develop the symptoms. So there is a lag. It can be about 3 to 7 days lag. And patients develop high fever. Very high fevers can go to 39, 40, and they have severe headache. They could complain of pain around and behind their eyes. The severe joint and muscle pain and bone pain. In the past, we used to say break bone fever. That's how strong and severe the pain of dengue is. And some patients can also develop a rash.
Right.
And as it becomes very severe, they can also develop bleeding.
Right.
Because the dengue virus, once it gets into the body, it creates an immune system that the body is trying to fight. And so there's a fight between the virus and the body. And during this time, the body gets weak. And if it affects the blood cells, then some of the blood cells, like the platelets, they tend to go down.
Okay.
And the ability of the body and the blood to be in the right state gets affected. So people sometimes get some bleeding, not all. Like we have patients who've had some bleeding from the gums. Some people, patients of mine, has actually coughed out some blood,
Right.
vomited out some blood. Some have some blood in the urine, or they have rashes on the skin, or easy bruising on the skin. So this is not common, but it can happen. And if it happens, that means it's actually a much more serious infection, a severe infection. Most of the time, people just have a bit of aches and pain, bit of fever, take some paracetamol, some fever medication and hydration, and they feel well. And few of them actually end up throwing up a lot, and they get dehydrated.
Right.
They have high fevers, and they just cannot look after themselves that well, and that's when we need to give them more treatment.
So far the reported cases and the extreme stage that they've reached, have there been any casualties or fatalities in the reported cases that you've received?
Since it started from November, December, we have seen patients. We've had about, on average, about in CWM hospital itself, about 5 to 7 admissions a day for dengue.
Oh my goodness.
And fortunately, we haven't had any casualties. They have all recovered pretty well.
From the admission cases?
Yes, from the admission
The
cases.
non-admission cases, have you had fatalities?
No, we haven't heard of any fatalities on patients that haven't been admitted.
Any
No.
in the health centers that you may have
Looking at
received numbers?
from the central division, from Mainubakasi to Nausori, Valelevu, Navwa, Samambula. Now, all the sick patients, they usually referred to CWM hospital. And if they are not very well from the accident and emergency department, they actually get admitted. So far, we haven't had any casualties. And though we had to give them some blood products and give them some very strong treatment, but they have all actually done well, and they have been discharged from hospital.
All right. What's normally the duration of a dengue patient that do make it or do it get admitted in hospital?
It depends on the severity.
Okay.
Initially, in patients with dengue, they have vomiting, fever, so then is a lot of hydration.
Yeah.
After a couple of days, then they start to feel well, and then their blood counts may get affected in terms of platelet count or their hemoglobin. And on average, if they are doing well, they stay about a couple of days, 3-4 days, and then they're out. But we still follow them up, because even though they're out of hospital, we have to call them for checkup once or twice, just to make sure the blood counts are all good and they actually feel well. Because after the virus has affected, it can take actually a couple of weeks to feel yourself again. Like though you are out of hospital or you're not having any fever, but you feel like you are down.
Yes.
So it can take 2-3 weeks or 4 weeks to really feel that you are out of it.
All right.
And those people who have diabetes, blood pressure, heart disease, or other concomitant illness, it can even take longer.
So when they get admitted, they normally stay longer than the 4
Yes, so if
days.
someone's got other diseases, then the recovery is slower, so they'll stay a bit longer.
All right. Now, Mr. Rama, how so far, what is the health ministry doing to in far of as in opposed to addressing the screening, the spraying process?
Okay, the Ministry of Health, together with the respective town councils, city councils, we are working together in combating the disease. There has been insecticide spraying carried out. Together with that, cleanup campaign for the source reduction. This is basically to reduce the breeding sites for the mosquitoes. So that campaign is also going on. And so once the area is, the cleanup campaign has been carried out in respective areas, then the ministry with the respective town councils or city councils, they carry out spraying, and that is to reduce the adult density of the mosquitoes. And then follow up with the mosquito larval survey to see whether there is any breeding sites that is still existing or not, and respective measures to be carried out.
Okay. Well, we'll talk to Mr. Rama more on this. But if you just join us once again, you're on Speak Your Mind. Feel free to call us up 3220-906 or 907 if you have questions for our guests in studio. But for now, we're taking a break, and we'll be back with more. Welcome back to Speak Your Mind, and we're in studio here with Dr. Shrish Ashraya. Excuse me, Acharya. I keep mentioning it wrongly. Forgive me. And also Mr. Vineshwan Rama, who's also the health inspector and now physician consultant from the CWM hospital, Mr. Dr. Shrish. Now, Mr. Rama, we're talking about the spraying. Okay, you're saying at the moment you're still in talks with the authorities involved, or have you guys done a study of where there are more mosquitoes or more infested areas?
Okay. We have actually already started the spraying in the Greater Suva area. Most of these urban areas for Suva city and the rural areas for Suva as well has been sprayed, has been carried out. Basically, the main focus of the spraying was areas where the cases has been reported,
Okay.
and now the spraying has shifted from Suva area to Nasinu area, and also in Nasinu and Nosuri area as well. This is just to note the areas where the cases has been reported.
So you're only spraying areas where cases have been reported.
Basically, from Suva to Nosuri corridor, we have sprayed the whole area, see, because for mosquitoes, they don't know the barrier. Like if I spray in Suva area and then the Nasinu area is just adjacent, so we have to cover that area too, because the mosquitoes can fly from one area to the other area. And it's not only that ministry is doing it, the councils are also working together with us. But the most important thing is we need the public's cooperation as well. For example, the ministry is carrying out the spray together at the town councils and city councils. But if the public as well, they do not cooperate with us, they do not clean their compounds. Like I was driving through the city area, and we have seen many garages and people at home, they are keeping unused tires, which is one of the major breeding site for the mosquito.
Right,
These
right.
dengue mosquitoes, they love to breed in that
Okay.
artificial containers. See?
Yeah.
And you cannot expect the health department or the city council officers to go from house to house picking up the tires, picking up all the tins and everything. So we urge all the public to please remove all those breeding containers, destroy it, so that if the compound is clean, there won't be any mosquitoes breeding, and then that's the only way we can stop this transmission of the disease.
Okay. Now, Dr. Srish, with being a consultant and also a physician, have you noticed a lot of, with your patients, are they normally from certain area? Do you guys have to like liaise with the ministry on areas that are more cases reported?
Yes, so the ministry's way of reporting and knowing where the cases are coming from is very comprehensive.
Yeah.
So when we have any case that is diagnosed with dengue or even suspected,
Yeah.
it goes through the subdivisional medical officer and the health headquarters,
Right.
and also to the communicable disease center, and they actually map out. So when we doctors are there, we ask patients, where they come
Yes,
from,
yes.
and that information is recorded. And when we notify that a patient has been suspected or confirmed of dengue, we include the address of the patient, and that's how they come to know that this person is from a particular area. But having said that, we are actually finding some difficulty, because patients and who are coming, they don't tell the truth.
True. Right.
I don't know, for some reason. So, they may be visiting here, but they don't tell that they are visiting to Samambula or Suva, and they don't give the correct address. So we have our addresses in our system,
Yes.
the computer system, but some of them will say, okay, I stay in Vatuanga. But Vatuanga is a big place, isn't it? So if I have to send the nurse or the health inspector to go and see that house,
Yeah.
then it becomes very difficult. And when they give in their phone numbers, they may give the mobile number that they hardly pick up, So in that way, if we can have that cooperation and support, that, just be honest, just give us the correct addresses. So especially in the beginning, when we start seeing few
Yeah.
cases, we can actually target.
That's
But
right.
once it's sort of grown out of proportion, then, if we say
Start-
Vatuanga, then we'll just have to clean the whole Vatuanga,
Spray the whole Watuanga area.
Yes,
That
so
is
in
actually
the,
what has
in the
happened.
beginning,
Yeah.
it's very helpful if they can be very specific,
Specific,
so that, we all have limited resources, and we all have to see where can we target this resource
Yeah.
to have the maximum benefit.
That's true.
And the information on from the patients in terms of the address is very helpful. In terms of this holiday season, people are just moving left, right, center.
True.
Whole of Fiji is, no one is staying put in one place. So it becomes challenging, but we have those notification, and that's how we have an infection control unit
Yeah.
in a hospital. We have similar units in the ministry, which actually coordinate through the laboratory system, which actually diagnose the patients with dengue from the blood test
Yeah.
and the doctors. So we all coordinate together to come up with a list
Yeah.
that these are the patients and this is where they stay.
stay.
and then this information is shared with our health inspectors, the municipalities, and those working on the ground to make sure that our resources are utilized to the best.
Yeah. So far, where have there been a lot of patients? Which particular areas?
Interestingly, we think that dengue is from the rural area or bush sickness, but it's actually been around the cities, around the municipalities. So Suva has been the main one. Not in like Samambula, Valelevu, not any particular area per se, but they all are being affected, and we are getting patients from them. So we haven't had sort of patients from the eastern or more from the rural, but they all being urban and semi-urban areas.
Okay, doctor, it was interesting. We were talking earlier on, and then you mentioned something about his system when an outbreak occurs. Now, how many diagnoses should you reach to qualify as an outbreak when it comes to diseases in the hospital?
Well, hospital system is a bit different than from a public health or a country point of view.
Right.
So if we have a certain number of patients, for example, if you're talking of dengue, we hardly have any dengue cases. If it's not an epidemic for some years, we just don't have any dengue. Then we get 1 or 2 dengue cases. And it's part of the, some people are coming from overseas, and they sometimes import. Yes. And then after a certain number is reached, only then we sort of say, okay, this is an outbreak. And this is calculated by our epidemiologist, who actually look at the public health. So they have the statistics and the numbers from the last few years, and they sort of see what is the baseline level and whether there has been a surge in that.
Okay, that's very interesting. And now, how can this be treated for those that do come in with dengue? Would they be able to treat it at home, or do they have to come to the hospital even if they show little signs of it?
So dengue severity has a spectrum. On one end is a very mild disease, where people have a bit of fever, body aches, pains. They can get hydration and they take paracetamol. Or Tylenol, Panadol, paracetamol, all those. Not to take aspirin or Brufen or indomethacin, any of those. And have a lot of hydration. So hydration is the key to treatment in dengue. And they can rest at home, make sure that if they have it, make sure there is no mosquitoes, otherwise they're going to spread it to their other family, especially children, who is very hard to control. They just keep running around. So they have to be very careful in that. And if their symptoms are severe, most of the time when they start to vomit and they can't tolerate oral fluids and in terms of hydration, that's when really they come to hospital and we have to give them drips because they can't take oral fluids. And then this other end of the spectrum, the severe spectrum, is where patients get very sick, their heart rate goes very fast, their blood pressure falls very fast, the kidney is damaged, the liver is damaged, the brain doesn't function that well, and they're really crooked and they're really dehydrated. So there's the other extreme.
All right. Well, thank you, Doctor. We'll actually come back to that. We're heading into a break, but like I mentioned, we're more than welcome to call in with your questions. 3220-906 or 907 is the number to call. And, we'll have more for you after the short break on Speak Your Mind. Welcome back to Speak Your Mind. If you just joined us, I'm your host, Serafina Wedlock, and we have in studio with us our representative from the Health Ministry. We've got our Health Inspector, Mr. Rama, and also Dr. Shrish, who's also a consultant and a physician at the CWM Hospital, telling us more about the dengue outbreak. Now, Dr. Shrish, you also mentioned the different spectrums of the dengue fever, from the very mild and also to the extreme. Now, have there been instances where you have employees or children that had just not been going to school and also have not been going to work?
Yes, fortunately we haven't had any fatalities or casualties on dengue, but that doesn't mean we just have to sit and not be bothered about it, because when a person gets dengue, then they are usually off work for a couple of days to a week or even more, and that really affects their their economy, their package, and if a person gets sick in the family, then the others are at a high risk.
Exactly.
So when patients come in, I usually tell them, make sure you kill the mosquitoes, otherwise the mosquito is going to kill you. You have to have that sort of attitude.
That's true.
Making sure that the places are clean, whatever you can do from your side, and avoid mosquitoes. So yes, very sick patients can stay for 2-3 weeks in hospital.
Wow.
I have a patient at the moment from the Nosori side. He came in very sick. We had to take him to ICU. But fortunately, he is doing well now.
Oh,
He's
thank
actually
goodness.
sitting and
Yeah.
eating and smiling to me. He was actually screaming and thrashing about when he came in.
Oh my goodness. Yeah.
And he's about to go home very soon. But it took us about 2 weeks to really settle him.
Wow.
Now, for that 2 weeks, who was looking after his family? He's married, he's got kids, and who's making sure that there is food in front of the people. So I think it has a bigger impact if you look in that way.
That's
It's a
true.
time of work, and now the schools is about to start in
begin,
2-3
yes,
weeks time.
yes.
So we really have to contain it, otherwise then children will be missing their school. So it's really for everyone to get together, and as we say, prevention is better than cure.
Exactly.
And so yes, the extremes are there, and if most of the patients that get admitted are usually because they cannot tolerate, and we have to give them drips.
That's true.
Fluids, yes.
Okay, Mr. Rama, what is the health ministry doing to address this outbreak?
Okay, for the health ministry, there's been a lot of awareness carried out.
Okay.
We are working with the community and the respective town and city councils for the source reduction, basically. Why we are focusing on the source reduction, let me explain the life cycle of the mosquito that is causing this dengue mosquito. Dengue is spread through the Aedes species of mosquitoes, Aedes aegypti and Aedes albopictus.
Right.
And these mosquitoes basically breed on artificial containers. And the female mosquitoes normally is the only mosquito that is biting humans.
Yeah.
So they need blood to lay eggs, and one female mosquito can lay up to 2 to 400 eggs.
Wow.
And these mosquitoes have adapted themselves so much that they do not lay eggs directly in water. They lay eggs on the edge of in any containers, water containing containers,
Yeah.
at the edge where the water is. So when the egg is not submerged in water or the water dries out,
Yeah.
the egg becomes cyst, and this cyst can stay last for 1 year or more. See, so
Wow.
and some people might say, "Oh, how come dengue is still in Fiji all this time?"
Yeah.
Like when a person is infected, then the mosquito bites that person, and the virus gets into that mosquito. Then every generation from that mosquito, all the eggs that will be laid, and the next generation carries that virus.
Ah.
So if one mosquito lays 400 eggs, and then it becomes a cyst for 1 year, and then
Comes
as soon
back.
as the water is there, then it hatches again, then those 400 mosquitoes starts transmitting the virus again.
Wow.
See?
Okay. Thank you for explaining that in details.
Yeah.
And so what has that's where they spraying. So you guys go out and do apart from according to the numbers that where there's a lot more infection, then you go out and do the spraying. So how many areas have been sprayed so far?
Basically, the whole of Suva city area has been sprayed.
Okay.
We started off from Watuanga and moved to the north, Tamavua area,
Mhm.
and Sambula up to Nambua. And now we have shifted to Nasinu area, and also Nasinu Town Council and Nasinu Health Office spraying that area as well.
How effective is the spraying, Mr. Rama?
Well, after the spraying, and before spraying, we have inspected the areas and questioned people whether there is lots of mosquitoes or not. And after spraying, we also carry out post-evaluation by carrying out mosquito survey to see whether there is any reduction in mosquito or not. At times, people say, okay, after spraying, they also see some mosquitoes. It does not mean that just after spraying, all mosquitoes will die. Like we are spraying close to the house and around the house, because
Yeah.
dengue mosquitoes normally they stay close to the house and around close to the people.
Okay. So this spraying, like you mentioned, the eggs become cysts. Does it kill those eggs?
No, when
No.
when the egg forms into cyst in the absence of water, it can stay there at least 1 year.
So this is where the importance of clearing away
Cleaning
your
the
empty
source
containers.
reduction. That's why we are focusing on source reduction. So every person, they should look around their house. If there is any container or tires or drums, whichever is holding water, please remove it, destroy it, so that water cannot be collected and mosquito cannot breed there. Apart from that, we have seen many places where people are keeping pot plants, and that is one of the major breeding containers we have noted in the central division.
Okay.
Lot of people keeping pot plants, and water is stored in that pot plants, and then mosquitoes breed in that. And then those mosquitoes, they hatch out within 7 days from egg and bite the people again within that same house, and then come back and lay eggs again. So that cycle continues.
Right. Now, in what ways can the breeding places be removed or destroyed?
Okay, like for example, the tires, or it can be, if it is not in use, it can be cut into pieces, or
Okay.
holes made on side so that it does not collect water,
Okay.
or stored in places where it does not collect any water, and all tins and other items, that the artificial containers,
Yeah.
it should be buried or removed
Okay.
and disposed of at the rubbish dumps. And other, if you are storing water in drums, please cover it, or if not, just pour a little drop of cooking oil or something, so that mosquitoes don't breed in those.
Mr. Rama,
drums.
for those in the rural areas or for those that have water tanks and collect water in water tanks, do they also, would this be a breeding place as well for mosquitoes? Or
Yes,
other
it can be
conditions
one of the breeding sources for mosquitoes, but the new design of these tanks have been seen that it has got a strainer on top, which
Yeah.
prevents mosquitoes getting in. I think when they were designing those tanks, we also liaised with those companies that were designing these water tanks
Okay.
to build a strainer on top. It not only strains the dirt, but it also prevents mosquitoes from getting into the tanks and laying eggs and breeding in it.
All right, that's great. Now, Dr. Shrish, you mentioned also about when there's an outbreak, the system or what the protocols that you have to follow through when that happens. Now, interestingly, we had a conversation about this earlier, but you know what? We'll come back to that. We're actually heading into a break, and we welcome your calls and your questions if you like. Feel free to call us up on 3220-906 or 907 or text us on 825. But yes, we'll be heading into a break, and we'll be back with Speak Your Mind. Bulavinaka, and welcome back to Speak Your Mind. It's our fourth segment for the show, and we have with us in studio, our topic today is on the dengue fever outbreak, and we have our health officials, Mr. Rama, our health inspector, and Dr. Shrish, who's also a physician and a consultant. Now, before the break, we were talking on, how the ministry works when there's an outbreak. But before we touch on that, Dr. Shrish, I'd just like to share an email that came in regarding this particular lady from Nandi. Now, she was a victim of dengue fever back into 1998, I think it was. Now, she says it is incredibly important for local health departments to stay on top of what's going on with the public health and also disease control and prevention. Now, in her opinion, health departments should be on the front lines of public health and also safety. The public would like to see different impacts by local health departments for public health and also safety. Now, apparently, she feels that there is complacency by Fiji's health departments as they only react during infectious diseases outbreak. Therefore, she'd like to know, why is this so?
So, in other words, the diseases are there, and why react so late? I think in terms of
Yeah.
outbreaks, when we define an outbreak, it means there is an increase in number from the baseline.
Right.
And yes, if there has been a dengue outbreak, then we should know what to do during a dengue outbreak, and we should try and prevent
Yeah.
a dengue outbreak from happening. And every time an outbreak happens in the 90s, in the 2000s, and in the past, we usually see a 8 to 10 year cycle.
Right.
So which the ministry knows, and we already have protocols, standard operating procedures, so that we activating the various teams
Yes.
of health professional to come and attend and try and contain the outbreak. Now, when we advise patients for cleanliness, we don't say that do it only now. It means you have to continue
Consistently,
and
yeah.
consistently do that. So that responsibility should come from both ends. I think it's a partnership, isn't it?
Yes, yes.
From the health ministry, we give them the information, and from the community, getting to be taking health and owning the health. There should be some sort of ownership. Even today, I was talking to one of the patients, and it's while talking, it seems like to an individual, the health is not theirs, but the health is Ministry of Health. So I think there should be a partnership and much more collaboration, that a person actually owns their health. They have that ownership. So when we say, okay, clean the compound, make sure the breeding places, even it's in the primary school health, books, the health sciences and the secondary school health sciences, when we go through how to contain breeding places, how to make sure outbreaks don't happen. But it has to be part of a day-to-day life, So if a child sees the mother or the father making sure it's all clean, the tins are buried, there is no tires, then they will do the same.
Exactly.
And if they're not doing it, then the elders need to tell them, it is important. It's not that we haven't had a dengue outbreak for 5 years, so you just get relaxed.
Yeah.
And from the health ministry's point of view, we have to be aware, and our systems in terms of our communication and coordination has to be good, so that we can pick up an outbreak earlier on and try and mobilize whatever resources we have so that we can contain it.
Right.
I think the biggest challenge would be to, if it is in Suva, let's keep it to Suva. Don't let it get out of Suva.
True.
And there's lots of roles that is played by various sectors, not only the Ministry of Health, but looking at the municipalities, the Agriculture Ministry, plus the ports where the cases actually come in. So it's usually the outbreak has been happening in the other Pacific Island countries recently, and it has come to Fiji.
Yeah.
So I think this time around Fiji has been quite vigilant, but things do happen. People come in, you have to fill in the airline form whether you have fever, and how many people declare those things. Some people
they just want to go.
They just want to go. So those things are simple things.
That's true.
But on a larger scale, it has a big impact.
That's so true.
So yes, the health ministry we can do to a certain extent, but I think it's the whole community from various angles. We need to actually make sure that the outbreaks don't happen in the first place, and if it does happen, then we contain it so that there is no casualties or fatalities out of the outbreak.
Naka, Doctor. Now, the other question that she also wanted to ask was, does the health department work closely with the hospitals and also health centers around Fiji to monitor public health issues?
Yes, very much. Actually, it's been going on for some years, for a long time.
Yeah.
For all infectious disease, there is a notifiable. It's a disease system. It's a manual system, so there is a book where and a certain diseases are already, like dengue is part of it, typhoid is part of it, leptospirosis, TB, and there's certain diseases that if a doctor or a nurse anywhere sees or suspects, they inform their seniors and into the health ministry's headquarters, or northern, central, or eastern division, wherever they are. And other cases are actually reported on a weekly and a monthly basis. Some are even reported on a daily basis. Like for the dengue at the moment, it's a requirement. It's a daily basis to report, and only then we can know whether the outbreak is continuing or it's coming to an end.
Okay.
So it starts from the nursing station, the health centers, the subdivisional hospitals to the divisional hospitals. It sort of goes up, and all this information is brought in, and this actually activates. And mostly the doctors in the health centers, subdivisional hospitals, they see that suddenly I'm seeing a lot of fever cases, and they are coming with body aches and pains, and they fit in with the dengue syndrome or profile of the patient, and they start testing, and then it sort of goes on with that. So because like dengue presents with fever, body aches and pains, typhoid comes with fever, body aches and pains, leptospirosis comes with body aches. So the presentation is quite similar in the initial stages, and influenza does that. So in the beginning, it can be quite challenging to actually break it and divide it out as to whether it is this disease or that disease. So as the disease progresses and as we start doing tests, then we know that it is dengue or it is not dengue. So going back to her question, yes, the ministry has that, and even the outbreak response. Like when outbreak like dengue happens, it not only affects the general public, and part of the general public is the doctors, nurses, and the health ministry staff also.
Sure.
So we are, if our staff gets sick, then we are faced with a bigger volume of patients who require our services, and then our own staffing numbers are down. So it's quite challenging. There are ways and means that the ministry is putting into place to try and cope up with this and mobilize the human resource and other resources in such a way that we can handle and look after as many patients as possible, and both in the public sector and the private sector.
Okay, well, I was going to ask you a question regarding that, but you know what? I'll come back to that later. If you just joined us once again, it's Speak Your Mind. We're heading into a break, but we'll be back with more. Bulavinaka, and welcome back once again to Speak Your Mind. Now, we're continuing with our conversation. Now, Dr. Shrish, okay, you did mention that sometimes it does affect the staff or the doctors as well and the nurses at the CWM hospital. Now, that actually begs the question. One of my friends had an incident the other week where she took her child into the hospital, and they weren't seen until 3 o'clock, and they left even without being seen. Apparently, there was a long line of patients at the A&E department, and only to be told that there was only one doctor available. Now, I have to ask this. You'd think with an outbreak such as dengue, they'd actually have the resources or have the doctors that are there to provide care for the patients. Now, you guys normally have, you change your staffing system to suit the number of patients that you have, don't you?
Yes, it's a demand and supply situation.
Right.
So the usual cases that come to accident and emergency, there is staffing for that. And as I said, in an outbreak, even our staff can get sick, and it really puts a lot of pressure and demand on us. So we do mobilize. So there's in part of the ministries that efforts in terms of making sure that there is enough staffing is during this festive season, this holiday season, we have cancelled the leaves of people who were going on leave.
Right.
Those that have already gone on their leaves, we have tried to call them back to try and cope up with the high volumes and the surge of patients that are coming. Plus even our own staff, we encourage them to make sure they look after themselves. But then people do get sick. Apart from that, we also mobilizing doctors from the health centers and other parts of the ministry where they may not be actually doing patient care. They may be in administrative work, so they do come and help. And in the central division, like the doctors in the diabetic centers and other places where they're not usually dealing with these cases. So in an emergency situation, in an outbreak, then we need to mobilize, and we do. So these are some plans already put in place by the ministry to try and look at this issue of staffing.
Have they been implemented though?
Yes, it has already been implemented in each department.
Okay.
That this is what we need to do and how we need to cope up with the surges when they come. Not only with the staffing, but also the resources. The number of drips and the needles, and then the number of blood tests that needs to be done. There is a whole surge at each level.
Okay.
If there is 5 patients, then we need the linen, the food, some people to wash the clothes. So the whole system has been revamped. We have had discussions few weeks ago actually through the whole hospital in the various areas that needs to be covered. In other words, to cope up with this outbreak on one hand, and then on the other hand, there is preventive strategies. So to contain an outbreak, the ministry is doing various ways. So on one side is destroying the mosquitoes, destroying the breeding places, making sure there's no the spread of the disease is less, and on the other hand, looking after people who already have the disease. So these actually two things that the ministry has to deal with.
Right.
And we are doing our best in both sides. So with the environmental health, when the municipality is trying to prevent the spread of mosquitoes together with our patients and community leaders, and then providing enough resources in terms of drips, needles, blood tests, human resource,
Yeah.
doctors and nurses to look after those that get sick.
So the ministry has their work cut out for them, especially
Yes.
during this outbreak.
Definitely. The outbreaks do happen, and we have our plans, and we just activate it. And as being part of the ministry, we have to just give that extra effort and extra push to ourselves.
That's true. Okay, Dr. Rama, how has the response been from the municipalities in coordinating with you on the with the health ministry on this outbreak?
Okay, we have been liaising with the municipalities, and they all have been cooperating with the ministry in the co-sharing of whatever activity that has been carried out. Like for spraying activities, so they are supplying with the vehicles or manpower, whatever
Right.
that is needed. And all municipalities are working together with the ministry. There is no way any municipality or the Ministry of Health can work on their own to fight in combating this disease. But what we need is the support from the public, because we have been noticing that even during the spraying period, when the notice is given to the public that okay, they will be spraying in this respective area, please open the windows and doors. Why we are requesting public to open the windows and doors of their house is because these dengue mosquitoes, after biting a human, they rest inside the house.
Okay.
They are more like a domesticated mosquitoes. They stay inside the house. So when we are spraying outside, we are killing the mosquitoes outside as well. But if there is any that is inside the house, it also gets killed. So we have seen people, when they see the spraying truck passing by, they'll quickly close the windows and doors. So please do not close the windows and doors. And after spraying, just look around the compound, destroy all breeding containers. You have to take responsibility as well. Like sometimes people say, oh, it's the ministry or the health department for respective municipalities or the Ministry of Health. They are not doing their work. We are there to advise you people to please destroy all breeding containers. We do not have that much manpower to go individual houses and collect all rubbish or destroy all breeding containers. See? Even if the respective municipalities, health inspectors or the government health inspectors, they go to a house, they may execute it for that particular day.
Yeah.
But for the mosquito life cycle, it's just a 7 to 10 days life cycle. When a leaf falls down in this, like due to the climate change, the mosquitoes' lifespan too has shortened.
Right.
And they breed faster. So
Okay.
within 7 to 10 days they breed. So you have to act accordingly and clean your compound.
And just be consistent.
Yes.
Okay, Mr. Shresh, Dr. Shresh, what other ways has the health ministry embarked on to see that the number of dengue cases reduced?
So as I had said before, there is a preventive methods. One is through the spraying, which
Right.
kills the flying mosquitoes.
Yeah.
Then clearing of breeding places, which actually kills the younger larvae.
Love it.
And also there has been a release of some other mosquito species that actually feed on the dengue mosquito larvae.
Oh, okay.
This is a sort of a natural way of combating that,
Yes.
which has been in place from before, not that during the outbreak, but it has been out from before. That's from the preventive side.
It's like a
Then-
biological control.
Okay. All right.
And then we have awareness on posters, programs, and this must thank the FVC for as part of the media awareness
That's right.
to educate people and make people aware that this is an important problem.
Yeah.
And then together with that, we have the treatment. So all the hospitals, we've had to get more, more resources,
Yeah.
drips and needles, and we had to sort of fund that also
Okay.
in terms of looking after. And we don't have an immunization for dengue. Otherwise, we would have had some,
Yes.
immunization of vaccines. So it comes back to hygiene, cleanliness, and early response and early visitation to the seeking medical advice and visitation to the doctors.
Vinaka, On that note, Doctor, thank you so much for being with us. And, well, to you listening in, okay, please do practice what the doctors and also what the health ministry are advising. That was Speak Your Mind for today. Until next week, you have a pleasant day.